The pharmaceutical and mining industries successfully lobbied RFK Jr. to withdraw the FDA's rule that would have required testing for the carcinogen asbestos in cosmetics. RFK Jr. withdrew the proposed 2020 rule last week on November 25th because, in his words, the proposed rule would have had unintended consequences for many consumer products. You might be curious as to who convinced RFK to drop the asbestos testing rule, so I looked through all of the letters submitted to the FDA. The primary groups that resisted the proposed rule were the United States Pharmacopoeia, the Essential Minerals Association, Vanderbilt Minerals LLC, the National Association of Manufacturers, the Advanced Medical Technology Association, and the Consumer Healthcare Products Association. The pharmaceutical, medical, and mining industries pushed back against the rule because it would have applied to cosmetics products as well as cosmetic products that are classified as drugs, and because it would have required more advanced testing that ensured there was zero asbestos. One of the main arguments from the trade groups is that they want the FDA to use USP testing methods instead of the proposed PLM with DS and TEM with EDS/SAD testing methods. The issue here is that over 5 years ago, the previous FDA administration already noted the shortcomings in specificity and sensitivity with USP testing compared to the now shot down electron microscopy based methods. Since many cosmetics and drugs are manufactured in China where asbestos is legal, the retraction of the proposed rule is quite concerning, especially given the large number of lawsuits against companies like Johnson & Johnson for asbestos in their baby powder products. The FDA said that they are reconsidering best means of addressing the issues covered by the proposed rule and broader principles to reduce exposure to asbestos. If you want more stories on food farming and health, be sure to give me a follow and subscribe to my Substack.